Hi, welcome back to the channel. I'm Jess, and today at Live UTI Free, we're wrapping up the discussion about using neuroplasticity and soothing skills to help manage recurrent UTI symptoms. Our guest, Evelyn Hecht, has been sharing tips that you can use to help calm an overstimulated nervous and immune system, which could be contributing to an increase of urinary and pelvic pain symptoms. In the first two parts of Evelyn's video series, she shared how neuroplasticity can be beneficial in managing recurrent UTI symptoms and how to rewire your brain to create new pathways. Today, you'll learn how to use that knowledge and skill combined with movement exercises. So if you missed video 1 or 2, go back and watch them so you can get the most from today's video. As we've mentioned before, during the fall of 2022, we're looking for participants to complete a patient perspective survey. Once published, this research can help clinicians better understand the patient experience of recurrent UTI. So if you haven't looked at that yet, click the link in the description to participate. Lastly, if you enjoy these videos, think they're important, and want to support what we do, be sure to hit subscribe and tick the bell so you can get notified when we post new videos. And other than that, thanks for joining us on this journey to bettering women's health everywhere, and enjoy the video.
As you move, sense the changes of pressure on your tailbone, your sacrum, your lower spine. Moving slowly, sensing the shift of pressure. Today we're going to talk about movement. How does moving your body help to heal recurrent UTIs? I'm going to tell you. So one of the things that the brain will do, along with sending your bladder or your urethra those distressful signals like burning and urgency, the brain also tells the muscles around the area to tighten up, to guard, like those Queen's guards in London with their tall bear hats. Rigid, unmoving, not allowing for good function. And as you learn, the brain is actively involved with protecting you, and so protection and guarding is part of it. So how can we unguard these muscles, and which muscles are they? Well, of course, the first one is going to be the pelvic floor. And if you haven't seen the pelvic floor, I'm going to show you. So if this is your pelvis, your front of the pelvis, the back of the pelvis, your sacrum, and then on the bottom of this bowl are your pelvic floor muscles. And so they are shaped like a diamond, because girls, we have to have our diamonds. And in women, they have 3 openings. So they have the urethra opening to pee from. Right behind that is the vaginal opening. And the last one there, the rectal opening. So these muscles of the pelvic floor, they are involved with a lot of different functions. Continence to prevent leaking. Being able to open fully to allow for bladder and bowel elimination. Being able to core stabilize, so when you move up from a chair and stand, your trunk muscles are all stable and supportive of your spine, your pelvic region. And also with sexual function, allowing for better orgasm, for better relaxation, all that. So your pelvic floor has lots of different functions. And so if the brain now is telling the pelvic floor to tighten up, it's also telling muscles like your deep hip flexors, the one in the sides of your spine, the hip rotators, the deep gluteal muscles, the inner thighs, the lower back. There's a strong correlation with chronic lower back pain stemming from chronic pelvic tension, because I'm going to share you with some really interesting information. A study was done with about 20 or 30 women. The study wanted to know what muscles tighten up first when a person is scared. So their participants volunteered to watch a film, and they had their body had a few areas of surface sticky electrodes on their muscles to measure the electrical current of that muscle. And so they place it on the shoulders, the inner thighs, pelvic floor, some other regions. So guess, when the scary bits came on in that movie, guess which muscle was the one that tightened first? Yeah, the pelvic floor. So we've learned that our pelvic floor is the first one to react when under worry thoughts or threat thoughts, or if we're feeling we're being attacked mentally or physically. a lot of patients, when I was working with them, would come in with recurrent UTIs and related pelvic issues. And I wanted to show them, what is your electrical activity of your pelvic floor muscles measuring? And usually a healthy pelvic floor muscle measures around 1 or up to 2 microvolts, which is measuring a current, electrical current. We're electric. Anyway, so we found that majority of women with pelvic floor dysfunctions, instead of being at 1 or 2 microvolts, came in between 8 to 15, and some of them 25. 25 is like taking your fist and squeezing it really tightly. And guess what? This automatic tension is occurring day and night. It doesn't let up. So you can imagine your pelvic floor muscles are just not functioning well because they're always in a state of tension. So part of PelvicSense incorporates what I call Move, and they are a series of 45 different gentle body movements that start out very easy, from diaphragmatic breathing. Because diaphragmatic breathing, when the diaphragm, your big breathing muscle, descends when you take a deep inhale, it actually helps the pelvic floor also move. And a lot of times if the pelvic floor is sort of raised up, like stuck up too tight, the diaphragm will allow the pelvic floor to move, and hopefully with your work of calming and movement exercises, the pelvic floor doesn't need to be guarding anymore because it's gotten more functional, and you're aware of how to react with dealing with stresses. So I'm going to ask you to be mindful of movement is just as important as learning information, practicing mind work, and also doing movement. It is a trio of healing skills that makes the biggest effect on healing. And you certainly can do this type of PelvicSense work while you're seeing a physical therapist, while you're going to get treatments by your physicians, because it's a combination of you're treating your body, you're treating your mind, and you're engaging in learned and scientifically proven skill sets. 20 minutes, 3 days a week, that's all you need, and over 3 months, because the nervous system, neurons, they need time to learn new skills. They need time to practice them. So learning and practicing the mind and body exercises, and you're going to get a sample now of what some of the exercises are. They're very simple. I start very easy and very simple because we want to help the nervous system feel safe. Let's start in a neutral position of your pelvis. Take a breath in. As you breathe out through your mouth, let's rock backward. A gentle flattening of your lower spine. Real easy, small movement. Now inhale as you rock forward. Exhale as you rock backward. Inhale, rock forward. Exhale, rocking backward. As you move, sense the changes of pressure on your tailbone, your sacrum, your lower spine. Moving slowly, sensing the shift of pressure. Moving from forward to pelvic, backward. So you're inhaling as your pelvis moves forward, arching your back. Exhale as your pelvis moves backward, flattening your back. 5 more. Forward, inhaling, backward, For those with a little bit of constipation or some abdominal colon discomfort, this is a lovely exercise that you can add. You can take your small roll towel, bring your left leg up, and once you have your left leg up, you can let go of the towel and you can bring your leg close to your chest. Now you will feel an increased downward pressure against your descending colon, which is great. It's like a little massage. Again, go to where you're comfortable but feels good. Soften, direct your breath into this area. Once you're done with those 3 breaths, release your left leg, bring your leg back down, Keep the towel on the lower edge of your pelvis. Bring your leg up of your right leg, grasp onto the outside of the right knee or behind the right thigh, and pull close towards your chest. Here is the ascending colon that's getting its massage as you breathe, as your legs stay resting in your hands, releasing a lovely massage for the colon with the single knee stretch. Lower your right inner thigh, right knee against those pillows to feel a gentle stretching of the inner thigh muscles. The hip adductors or inner thigh muscles are directly connected to our pelvic floor. And a lot of times these muscles are the ones that are super, super tight. So a gentle opening is a great first step. This is called the butterfly, single leg, single wing, and we're giving a gentle stretch with our hand on top of our knee. If this feels very easy, not much of a stretch, then you can remove one pillow and bring your leg on top of that pillow easily, comfortably, so you get a little bit more of a stretch, and then give a downward pressure of your hand on your right knee. Do this for 3 breaths, allowing that inner thigh to be stretched, to relax. Let the pillow give you that support for your outer thigh. There should be no pinching, no discomfort. Your hand is giving a gentle downward pressure, allowing that stretch to occur. After your 3rd breath, you can release the pressure on your knee, assist your knee back up to the center, switch pillows. So now you're on your left side of your hip, and drop your left leg down to that side. I'm going to lower my right knee so you can see better. So my left hand is on top of my left inner thigh, and my left leg is completely resting and supported by that pillow. If this feels too easy, you can bring your leg a little bit higher, and you can drop your leg a little bit lower. Again, what is all comfortable for you is the best way. Do your 3 breaths. And when you're ready, you can release that pressure, bring your leg up to the center. And now let's do it once more on each side. Go to your right side again. You're going to lower your right knee over that pillow. Place your right hand on top of your inner thigh or right knee. Downward pressure. Gentle pulling on that right hip adductor. Relaxing your pelvic floor as the hip adductor stretches. Easy, softening, comfortable. And once you're done with your 3 breaths, you can bring your leg back up to the center, give some support. Take your pillow, switch over to your left side. Let your butterfly wing open on your left side. Inner thigh stretches, gives a downward pressure, releases a good sensation of stretch, relaxing your pelvic floor, breathing, stretching, introducing some length into these muscles. And after your 3rd breath, you can bring yourself back up to the center, bring your legs over the pillow in front of you, and just let yourself relax and absorb that stretch.
I hope you enjoyed those movement exercises and are able to incorporate some into your healing routine, after speaking with your doctor, of course. If you enjoyed these exercises, you may be interested in Dr. Bree's Bladder Health playlist. I'll put the link to this playlist in the description. Of course, if you like what we're doing on this channel, make sure to hit the subscribe button here on YouTube and tick the bell so you get notifications about future videos. Thanks so much for watching, and until next time, keep educating yourself so you can advocate for yourself.